Hello, everyone, and welcome to the Parkinson's Foundation's Wellness Wednesday webinar. Thank you so much for being here, and I'm glad that you could make today's webinar. We want to thank today's webinar sponsor, Acadia Pharmaceuticals, for supporting the mission of the Parkinson's Foundation. Before we get into it, I want to remind you about our other PD Health at Home virtual programs. Each week, we offer sessions tailored to support people with Parkinson's, their care partners, including Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays, expert briefings, and our Spanish language series, Y Salud en Casa. Be sure to visit our website to see what's coming up and explore our archive videos on YouTube. Movement symptoms can complicate the daily activities a person living with Parkinson's once did easily, like getting dressed, eating, sleeping, and even walking. It can be hard to adjust to these changes, but there are many things you can do to support a good quality of life. Our next Wellness Wednesday, you will learn practical tools and strategies that can help you address the movement challenges that are common in Parkinson's disease. Learn more about upcoming virtual programs and register at parkinson.org/pdhealth. PD Health at Home is presented by the Light of Day Foundation, whose generosity has made this programming possible. Today's Wellness Wednesday webinar, we focus on knowing when it's time for additional support. This program will provide tools to help you decide when and how to take the next steps in care. You will also learn strategies to guide difficult conversations about transitioning to a care facility. Leading the discussion today is clinical social worker Erin Cecchi. Erin Cecchi is a licensed clinical social worker with more than a decade of experience in healthcare. She has worked at leading medical institutions across the Midwest, including Rush University Medical Center, where she served as lead social worker for general neurology and neuromuscular departments, and Northwestern's Parkinson's Disease and Movement Disorder Center, where she was the senior program coordinator. She currently works at the University of Michigan's Movement Disorder Program and also serves as a cognitive consultant for Cognitive Concierge, supporting families navigating dementia and other neurological conditions. Erin is passionate about supporting older adults, individuals living with neurological conditions, and their care partners. She brings both clinical expertise and heartfelt compassion to her work. Erin holds degrees in social work from Michigan State University and the University of Michigan and is licensed in the state of Michigan. Erin, thank you so much for joining us today.
Thank you so much, Krista. And thank you for all being here. I'm just going to share my screen and then we will get started with today's presentation. All right, so as Krista said, today the topic is it time to move? Next steps in care. So this is a big topic that I hope to, bring some grounding to in terms of, again, kind of being able to know when it might be time to move, again, some indicators, and start these conversations. So personal disclosures, as Krista said, I'm a licensed clinical social worker in the state of Michigan, currently employed by U of M in their movement disorder program. No financial or commercial conflicts of interest to disclose, and my perspectives are informed by my clinical experience and, of course, my deep commitment to supporting individuals with neurological conditions and their families. So today, our learning objectives identify key indicators that suggest a move to long-term care may be necessary, understand how symptoms such as hallucinations and delusions can impact the ability to provide care at home, explore tools for evaluating and selecting the right care facility, including essential questions to ask and how to determine the appropriate level of care, and learn strategies for having thoughtful and compassionate conversations about when to transition to a care facility. So, why early planning matters and why we avoid it. So, when it comes to deciding when it's time to move, early planning truly makes all the difference. So, by starting these conversations and making plans ahead of time, we can avoid crisis rush decisions. These can be stressful decisions, and so planning ahead gives us space to consider thoughtful, informed choices. Of course, early planning also ensures the person involved can express their wishes clearly, which is so important for respecting someone's voice and autonomy, again, before emergencies arise. So it really can help reduce family conflict because everyone is on the same page and knows the plan well in advance. So this very much can ease tensions that can often arise during periods of uncertainty. Of course, early planning can lighten the emotional load, right? Planning ahead can reduce stress and the feelings of guilt by making everyone feel more prepared and confident in the path forward. So, despite the benefits of early planning, we know that many people may avoid these conversations for very understandable reasons. So, sometimes there may be a sense of denial in that, people understandably just don't want to admit like we're not there yet. It's just too much to talk about. Fear can play a role because we're talking about care and acknowledging, the need for more care can kind of impede on our sense of independence and what that means. Caregivers can maybe carry guilt or understandable other similar emotions, feeling like we should, right? That often we should on ourselves, that we should be able to manage everything alone. Family tension, differing opinions can make bringing up this topic feel like a can of worms. And cultural beliefs can influence how families view outside help, with some seeing it as giving up on family responsibilities. So, understanding why people avoid it, again, for understandable reasons, can be helpful and key in approaching this conversation with empathy and patience. So, understanding long term care options. Well, when we talk about long term care and we use the term long term care, we really can be talking about the broad need for ongoing help with everyday activities, from bathing, dressing, medications, mobility. But we also could mean specific settings where care may be needed in the future. So, long term care can cover a wide range of support, from occasional help in the home to more full time medical care in a facility. It's important not just to focus on where someone receives care, but the level of support needed to stay safe and maintain dignity. And there are several different levels of care available, and this slide is going over those levels of care, which are each designed to meet, again, various needs and preferences. So, home care is often the first option. This is where care is provided right in the person's own home, often provided by family members or professional caregivers. So, this may work best for mild to moderate needs when there is, again, that strong support available. Assisted living can help offer a little more help with daily tasks like meals, medications, health monitoring, allowing individuals to maintain independence, but receiving support needed. For those facing Parkinson's with cognitive impairment or concerns, memory care can be a good place. This is again providing secure environments with trained staff who understand unique cognitive needs. Skilled nursing, is good for individuals with complex or advanced health issues, offering 24/7 medical care and rehab services. Group homes can provide a small home like setting with personal care supervision for those who want a little more like intimate community feel. And lastly, continuing care retirement communities essentially is one level or one campus with multiple levels. So this can give individuals flexibility to age in place as their needs evolve over time. So as you can see, each different long-term care option offers unique benefits that can be tailored to different stages of care and care needs. And early decisions about the right level of care can truly improve quality of life for the individual needing care and those providing that care. So, big question: when does long term care become necessary? And so, we're going to explore some common signs that indicate when more care might be needed, when it's time to consider. So, difficulty with daily tasks. So, when someone is struggling with basic activities, bathing, cooking, walking, this can certainly be a sign that more care is needed. When individuals are experiencing memory loss and confusion, issues like forgetfulness, disorientation, wandering, of course, increase safety risks, and this often can require more specialized care. Another indicator is repeated falls or safety concerns. So, frequent falls or accidents at home can indicate that that home environment is no longer safe without extra assistance. Medication management challenges, missing medications, or mixing up medications can lead to serious health problems and often may require professional oversight. Increased caregiver strain is also an indicator that more care may be necessary, right? When family caregivers feel overwhelmed, exhausted, unable to provide adequate care to no fault of their own, but the situation, the demands are too much. Again, this is when it's important to consider outside help and just the complex medical needs. So not only, Parkinson's motor symptoms, but there's non-motor symptoms and you could have other conditions underlying it. So there's a lot of complexity. And if health issues become too complicated to manage at home, again, a higher level of care may be indicated. So oftentimes it's not just one factor that indicates that long-term care may be necessary, but it can be multiple things happening in a pattern that tells us a transition may be approaching. So, tools to guide care decisions. So, when planning for care transitions, using structured tools can really help in both understanding the needs and easing the emotional load. So, there are needs assessment tools like activities of daily living checklists or caregiver strain index that can help clearly identify the level of support needed. So, whether that they can live independently, need in-home help, or should consider a facility. And so when I say activities of daily living checklist, this is literally what it sounds like. It is a list of all activities of daily living, from bathing, walking, managing medications, paying bills. And the more you're checking off that you're needing assistance with those activities or that the person that you're caring for is needing assistance, again, that can be a good indicator. And again, if you do an internet search for ADL checklist or caregiver strain index, those could be something that you go over, by yourself or again with your care partner to say, okay, how many of these am I checking off and what does this mean? There's also care transition readiness checklists, and these can prepare individuals and families for big changes by covering aspects such as medical needs, home safety, medication management, emotional support. So, again, these are checklists that kind of have broad strokes categories that can say, okay, no, how are we doing in this area? What needs to be done? And these can be, again, Googleable, or again, you can talk to your healthcare providers about maybe obtaining some of these checklists. And then, of course, involving healthcare professionals, right? Your doctors, your neurologists, clinical social workers, nurses, they can offer invaluable insight and help evaluating care options, especially obviously when, for conditions like Parkinson's or individuals experiencing cognitive symptoms. So, using tools and having conversations can bring objectivity to an understandable emotional process. And it also reminds us that needs evolve over time. So, revisiting, taking these assessments, having conversations with providers over time is really key because it opens us up to consider options that maybe we wouldn't have otherwise considered. So, understanding the impact of psychiatric symptoms. Hallucinations and delusions are psychiatric symptoms that, of course, significantly impact care needs. Hallucinations involve seeing, hearing, or sensing things that aren't real, and delusions involve strongly held beliefs that could be paranoid or mistaken. So these symptoms can cause unpredictable behaviors such as agitation, confusion, aggression, and increased safety risks like wandering and falls, especially at night. So, because of this, individuals experiencing these symptoms often require constant supervision that can go beyond what someone can provide at home. And since home environments often lack resources for 24/7 monitoring, moving to a professional care setting often becomes necessary when these symptoms are at play. And again, when we talk about these facilities, they often have, or they should rather, right, have trained staff and secure environments that they are designed to manage such symptoms safely. So the emotional toll on caregivers can be so overwhelming, leading to stress, exhaustion, feelings of helplessness. And again, these all make outside care essential. Again, no comment on the quality of care of the caregiver, just the situation is such that we have to look elsewhere for outside help. And transitioning to specialized care isn't about, again, giving up. It's about ensuring safety and maintaining quality of life for the individual and caregiver. So, this slide depicts a real world example of someone I was working with who kind of how their psychiatric symptoms impacted care decisions. So, I was working with a spouse of someone with Parkinson's and dementia. And through those conversations, we were talking about the situation at home, the feasibility of staying at home, what options existed, and kind of what that care transition might look like. So again, I was talking to a spouse, and the person with Parkinson's and dementia began experiencing frequent hallucinations and wandering. Over time, the wandering would become more and more frequent, which posed significant danger and safety risks. So, even on several occasions, the person with Parkinson's and dementia was wandering outside the home to the point where a construction worker found the person over a mile away from home. And this was happening multiple times per week. And so the spouse and I talk, we would say what non-pharmacologic, right, more behavioral based calming strategies would work. We employed the help of the doctor, what medications may help to manage these episodes. The care partner and I also discussed measures, installing door alarms, are there locks, using Apple AirTags, tracking devices, phone tracking to kind of keep tabs on the whereabouts. So, despite all these efforts, it just became clear that the situation was too overwhelming and again unsafe for the individual and the caregiver. And at that point, she and I started exploring memory care options, recognizing that truly a professional, secure environment was what was needed in this situation. And eventually, the person transitioned into a memory care facility. So it's important to acknowledge that, again, this process is never easy. It is so emotional. There's emotional and practical challenges, but truly moving to a care facility is necessary oftentimes to ensure safety and improve quality of life for all involved. So, evaluating care facility options, this can feel like a tall task. And so, when evaluating care options, it's important to consider, some key factors that can directly impact quality of life and safety. Right. So staff training is crucial, and there are some questions that we want to ask to ensure that staff are capable of caring for the person. Right. So caregivers should be knowledgeable in Parkinson's care, dementia, mobility support. Are they receiving ongoing education in medication management, in neurological conditions? How are the staffing levels? Staffing levels matter. So, understanding the staff to resident ratio, both during the day and night, can indicate how much personalized care the resident is likely to receive. Which then brings us to questions about resident safety. This is another top priority. How are falls prevented? Do you have grab bars, call systems, safe flooring? What are the emergency procedures? Secure exits are essential for those who may be at risk of wandering or confusion. So, checking on those things. Finally, asking about daily structure and engagement is very important, as we know this greatly influences well-being. So it's important that we're asking about how activities are tailored to somebody's interests and abilities, with thoughtful support for social interaction, especially individuals with Parkinson's who have, fatigue or apathy. So again, together these elements create a supportive and safe environment, and so we want to be able to check in and evaluate these things. Also, with evaluating, asking about medication management is vital, especially we know for people with Parkinson's where medication time, does impact symptoms a lot. So it's important to know how often are medications administered and whether Parkinson's medications are given precisely on time or outside of regular, even when it's outside of regular medication rounds for that facility. Facilities should have clear systems to monitor and document medication adherence to make sure nothing is missed. So, again, we want to ask about that. How are you guys tracking? Cognitive changes, of course, again, are important things to check in. Hallucinations, confusion. How does this facility handle when someone is going about that? Are they trained in non pharmacologic interventions? Pharmacologic being medications. So, non pharmacologic, besides giving medication when someone is agitated, what do you do? What gentle touch? What activities? What reorientation strategies do you use? And family involvement, right? Just because if you're caring for someone and that person is in a facility doesn't mean that you're removed from the picture. You very much are still a caregiver. And so, what is that family involvement? How are families kept in the know? Are there regular meetings? So, these are all really crucial things to know. And again, asking about these things, ensures that the best possible care, again, for both the individual living in the facility and the loved ones and caregivers. So, tools for evaluating care facilities. So, when researching care options, there are several valuable tools that can help individuals and families make informed decisions. Medicare.gov's Care Compare website allows you to compare skilled facilities and rehab centers. So, you can view ratings, safety reports, available services, and this can provide an overview of quality and compliance. There are printable checklists that you can get offline, and actually I sent one to the organizers that they can email to you in the after, presentation email, that you can bring along to ask about staff, safety, meals, activities, again, overall environment. So these checklists can really kind of help you make sure you're evaluating all the important spots. There are state licensing websites that can offer another layer of insight. So, state licensing websites can allow you to check inspection reports, complaints, and licensing status. And again, you can search by your your state's assisted living license lookup. And online reviews and forums. Of course, I would say take what you read online with a grain of salt, but also you're getting people's unadulterated experience, both good and bad. So there are online forums such as caring.com, senioradvisor.com that can provide personal experiences and feedback. And so it can be important to look for patterns across multiple reviews rather than focusing on a single option. So, again, these tools, having conversations, going to the facility, talking to other residents and families that are already there, this can give you a well rounded picture to guide decision making. So, again, why this conversation matters. I know we addressed this at the beginning, but it really does beg repeating, especially now that we're going to kind of talk about having the conversation with each other about this. So it's good to refresh us again. Why are we here? Why do these conversations matter? So we know as Parkinson's disease advances, having open and honest conversations become increasingly important. in order to respect care preferences, maintain safety, and again, as much as possible, avoid future stress or confusion. And so we know, although these talks are essential, we hesitate due to fears of upsetting loved ones, losing independence, fear of saying the wrong thing. And again, feelings are natural. However, we know that approaching them with empathy and clarity can strengthen relationships, improve planning, and create a shared understanding. So, common hesitations. I don't want to upset them. They're not ready. I'm afraid. What if I say the wrong things? Again, these are all natural hesitations. But again, can we just take it one step further? Well, what are those hesitations holding us back from? As uncomfortable as engaging in those conversations is, there often is a weight lifted off of us when we do engage in these, and they really can enhance quality of life and reduce stress. So yes, uncomfortable, stressful during it, but there often is this sense of relief afterwards. So how do we engage in these conversations? So first and foremost, just with the environment, creating a safe and supportive space is key. So choosing a quiet, calm time, ideally not in a time of crisis, which is again why we're talking and emphasizing the early aspects of having these conversations, and to encourage open sharing without judgment, be fully present, minimize distractions, really listen to what someone is saying, avoid thinking as much as possible about what you're going to how you're going to respond, just really listening and tuning in, speaking from the place of I, kind of these common conversational things that we do, and maintaining eye contact, again, these basic communication things, just making sure we're really attuned to one another and just acknowledge the difficulty of this topic with kindness. I know this is hard to talk about, using gentle, clear language and starting with observations. I've noticed it's getting harder to get around the house. Can we talk about that more? So, again, these can kind of give us, again, starting with the environment, like a way to engage in this conversation and trying to reduce overwhelm and rushing the conversation. So, also, when having these important conversations, it's essential to pay attention to not just what's said, but what's also communicated non-verbally, right? So, body language, facial expressions, often when something's overwhelming, we can read it on someone's face. That might be a good indicator. Okay, you're reading it. Hey, you seem really overwhelmed. Should we pause? Can we come back to this? So, again, picking up on those body language cues can be very important. Um, and using tools, visual aids, written notes, reassuring touch. This again, emphasizing that decisions are made together, right? Like this is a partnership. You're not alone in this. I want us to make these decisions together. I want you to be involved in every step of the way. So again, making sure someone's involved every step of the way begs us to start these conversations early. And when it comes to discussing difficult topics such as making a move, care needed in the future, it's best to approach the conversation gently, right? Start small, set the pace. And again, this ideally is going to help reduce overwhelm and build trust. So topics can include, right? We don't have to jump to where you're going to live in the future. If things become too much, let's talk about safety in the home, fall risks, preventative measures, changes in mobility, advanced directives, right? Those legal documents. And then, of course, future living arrangements. So it doesn't have to be one big conversation. We can kind of talk about things along the way. And again, keep be mindful of pace, asking permission. Would it be okay if we talked about care options right now? So, again, keeping family members, care partners, professionals in regular communication help ensures that emotional needs are met and that care decisions are aligned. And of course, when planning for care, um, it's important to recognize that families may have differing opinions and roles in decision making. So, cultural values can deeply influence how aging, independence, and caregiving are viewed. And so, respect for these differing opinions is key. So, care decisions work best when they involve shared input for family members. And sometimes bringing in a neutral third party, such as your neurologist, a social worker, or care manager, can really help to guide these discussions. And so, again, ideally, the care plan should respect the family's cultural values and support everyone involved when we're having these, intimate, emotional laden conversations. So tools, not only tools and resources for having these conversations, but what local supports are in your area. Well, the Area Agency on Aging, again, this is a name for essentially organization. They're offered in different geographic areas all across the country. These are organizations that connect older adults and caregivers with local supports. This could be home care, meal programs, again, referrals out to community facilities, advocacy, caregiver assistance. So it can be a valuable resource for accessing practical local support. Of course, I would be remiss if I didn't mention Parkinson's Foundation, their hotline, their website. Again, key for connecting individuals with Parkinson's and those affected by Parkinson's with specialized guidance, information, access to local resources, and again, both practical and emotional support. Medicare has a nursing home checklist, of which I provided the link to. So, again, this can help individuals and families evaluate and compare facility options. So, it's a detailed checklist, covers key areas, resident appearance, living spaces, meals, staff interaction. So, this is a tool that you can bring as you're touring and kind of, again, make those checks off. And I also, again, gave Parkinson's Foundation a list of my own that they'll send out to participants as well. That's a little bit of an iteration of this as well. Other tools and resources. So, the Conversation Project supports individuals in discussing end of life care wishes. And so, I know today's talk is about when it's time to move, but I think that overall, this speaks to the need to talk about other tough topics. And so, the Conversation Project really gets, people talking about, again, what do you want? Not only towards the end of life, but just throughout your journey, with having different conditions. So it offers conversations guide, it has personal stories, downloadable resources that can make it easier to start talks. So especially if you're one where like I don't know where to start, this can be really grounding for everyone involved to have a piece of paper and questions and conversation starters. In a similar vein, our care wishes helps individuals clearly document and communicate their values, goal, treatment preferences for care. And again, I think this lends itself to talking about care needed in the future. If and when more care is needed, who do I want to receive it from and where do I want to receive it, right? Which is kind of today's talk. It can offer advanced care planning tools, decision making guidance, and worksheets to, again, ensure that your care aligns with what matters most. So these resources again are great for anyone wanting to approach these discussions thoughtfully and with clarity. So key takeaways. So as Parkinson's progresses and care needs increase, it's crucial to recognize when additional support or a higher level of care is necessary and understanding how behavioral symptoms such as, changes in cognition or mood can affect safety, this can help guide timely decisions. Using available tools like checklists, facility comparison resources can make evaluating care options feel more manageable and informed. And of course, equally important is approaching these conversations with empathy, patience, and openness. And as this can help maintain trust and collaboration throughout the process. So, my ask of all the participants is, moving forward, start by having one conversation this week, right? Whether it's about daily needs, safety, future planning. and, use the checklist or assessment tool if it would be helpful to kind of help organize thoughts and clarify priorities. And remember that the best time to plan is before a crisis arises, and even small, thoughtful steps now can truly lead to smoother transitions, better care, and peace of mind for all involved. So again, I know we went through that, and it's a lot to process and consume, but I'm hopeful that this kind of started you by thinking about, what care options, are available and kind of get you talking about important things.
Thank you, Erin. And my friends, we have time and we have Erin present today. So if there's a question that's like lingering and you're wanting to ask the question, now's the time. So you could write that in the Q&A for us to share with Erin. Um, Erin, I want to talk a little bit about balancing independence and safety. So, how can we balance the desire for someone to want to remain independent when there's real safety concerns at home?
Yes, this is a huge and nuanced, and so personalized. So this is something that I think I hear often, probably multiple times per week, and I'm sure a lot of the people on the call experience, right? There's this drive to maintain independence, which often is so tied to staying at home. But are there, can we expand maybe what it means to be independent? So I think there's that aspect, you know, um, and are there things that we can still do independently, um, or and things that maybe we need help with? So it is shifting what independence looks like potentially. And I think it also begins with having open and honest conversations with each other, as a care partner. Like, I want you to be able to do these things at the same time. Can you recognize, like, can there be recognition, or, can we speak to that this makes me really anxious when you just get up and go without requesting help. So it's nuanced, and this is where, so not only open and honest discussions about this, and again, maybe can we look at what independence means in a different vein, but also are there, outside help or tools that can help maintain independence, right? If we need maybe a walker to help walk safely, or maybe there's sometimes we talk about this impulse to just get up and walk, and we might not remember to use a walker. So maybe we talk about getting a chair alarm so that at least a caregiver could know when that person's, the person is up and mobile and walking, but we don't necessarily, but that person can still maintain independence in getting around their house. So it is very nuanced. And I think that this is where thoughtful conversations, with your care team are important. So talk to your doctor. What is going on? What are you struggling with? Are there things that we can bring in the home to kind of, again, maintain independence as much as possible? And oftentimes, just like with many things in life, like, it's compromise, give and take. It's not necessarily going to be 50-50. Maybe again, be independent was. Maybe there is oversight that's needed, and that is an understandable shift. So let's talk about the emotions involved. Let's speak to these things that maybe go otherwise unspoken because it's taboo or uncomfortable. So it's, again, I think this is where that process is evolved. Like, we try to, what's most important to you, and how can we maintain that as much as possible while appreciating that some situations, like, safety has to be prioritized, and it doesn't mean that the independence has to go to the wayside, but there are just some situations where we may need to intervene more. So, again, I just encourage everyone to bring these concerns about independence and safety to your care providers, because again, maybe we don't have all the answers to everything and tie it up in a neat bow and say, hey, here's exactly what you need to do. But again, sometimes the situations, can be worked out where we're trying to get everyone's needs met. And so your providers can, again, make recommendations based on your specific situation.
Yeah, so I'm hearing let's talk about it. One,
Exactly.
let's define what independence means for both parties, care
Yep.
partner, person with Parkinson's, and maybe we talk to a neutral person who's not me, feeling a little burnt out, frustrated, anxious, who's not you, who wants to maintain your independence and can give us sort of a subjective outlook on how we can move forward with maintaining independence while also considering safety.
Exactly, right? I often use the barometer of safety and sanity for
Mhm.
everyone involved, and sometimes those feel like they're diametrically opposed. But again, can we try to get a semblance of both safety, obviously for the person who may have mobility or cognitive symptoms that put them at risk, and sanity of the caregiver in, right? There's often this hypervigilance of, I have to make sure they're okay. Well, yes, maybe there's inherent risk at life,
Mm.
but how can we again attend to both those things?
Thank you, Erin. I'm hearing a lot of about communication, right? And I would say like 45, 50% of your presentation was really linked to having the conversation. And I know that these conversations are difficult. And what I also know is the more often we get comfortable having difficult conversations, the closer we can feel to one another. So I highly encourage to open the conversation. I'd like to shift gears now and just and enter the sphere of financial and practical considerations when we're considering is it time to move. So how should families begin to navigate sort of the financial implications, if you will, of long-term care? Are there resources that can help them plan ahead?
Absolutely, yes. I mean, yeah, while today's conversation was very much, not focused on that, obviously that is a big factor in care decisions and long-term care options. So I would say this is where a few different things. Um, Elder law, financial planning can come in, in terms of if you have a financial planner, meeting with them, talking about, okay, ballpark, like if this type of care is needed, it's, potentially going to cost, let's just say 10 to 15,000, which, I know is a sticker shock, but it can be that much for like the highest level of care. Do we have that? If not, then there often are state subsidized resources that can help. And this is where I will plug your area agency on aging. So your area agency on aging is going to be either the administrator or point you in the right direction of your state specific programs that offer in home care. Or again, states' Medicaid programs is one of the biggest providers and payers of long term care in the country. So, Medicaid will pay for care in a skilled nursing facility. So, again, that's when people need that kind of complex. Medicaid does not pay for assisted living, although I will say that some states have Medicaid waiver programs that may help with in-home care and assisted living. So again, getting the ball rolling, what are our finances? And if they're, more meager, then let's start exploring what programs, maybe not now, but in the future that, you or someone that you're caring for may be eligible for. So I would say calling your local area agency on aging to say, "Hey, what does Medicaid pay for?" Just learning, getting informed, right? Medicare unfortunately doesn't pay for long-term care. It really is often private funds or Medicaid. So I think, and this is also where elder law again comes in terms of, are there ways and strategies to protect certain assets so that, often we're dealing with an individual who is needing long-term care and a spouse who isn't. So how do we protect the community dwelling spouse, the person living at home from depleting all their assets while the person who needs care in a facility can receive that? So I think seeking elder law, consultation, if you're already talking to a financial planner, doing that. And I think going to your local area agency on aging. And if you're connected to a clinical social worker within your clinic, I think talking to them about your situation also can be really key and they can point you in the right direction.
Thanks, Erin. And Anna, I hope that answered your question. Let us know in the QA if that was a sufficient response for what you needed. Want to address Edward's question, and if we could keep it succinct, because this is not really specific to our subject. Edward, we have so many resources about driving specifically in Parkinson's, but I think Erin's a good gal to ask this question too. So could you address the difficult question of when to stop driving, when someone with Parkinson's should consider to let go of the privilege to drive?
Yeah. I mean, very good question. And I think, again, is in line with today's talk, just in terms of bringing up and talking about uncomfortable and challenging topics. So I think often it's going to be brought up by family or your neurologist. But I think, right, there are some signs and indicators. And again, this is where I try to depersonalize it. It's not often that your family doesn't trust you, it's that your symptoms are such that we don't have control over them. And it just warrants us to maybe step back. So, again, this is very nuanced, and I'm sure we could do a talk on this, but I think it's being open and honest with, if you're the person with Parkinson's, like, what are you having difficulty with? What is your reaction time? Are you finding that, have there been accidents? Have there been near accidents? Are you maybe, having difficulty stopping when the light changes? Are you having difficulty changing lanes? So you try to find yourself staying in one more lane. And this is also where outside assessment can be beneficial, right? There are occupational therapists out there that do exclusively these driving assessments, both in clinic and then also behind the wheel. Um, these driving assessments are often, I would say, $100 to $200. They're not covered by Medicare, but again, if you are one that, like, "No, I need objective data to tell me that it's no longer safe to drive," then, I think this could be a valuable thing to pursue. So again, there definitely are signs in terms of, you know, accidents, near accidents, and just safety. I mean, I think sometimes there also is this empowerment with giving, the person with Parkinson's or, cognitive decline themselves saying, "I'm not feeling safe." Like, while it's something I don't want to give up, like, I know it's something I have to. And of course, again, this can get nuanced, and sometimes outside intervention is needed, to make sure that someone is not driving when it's no longer safe to do so. So
I
again,
really appreciated,
topic.
Erin, how you said take the personal out of it, right? When you drive, it's not just about you. It's also everyone who else is on the road and the people that care about you. So taking the personal, I want to say tinge or charge, and really thinking about it from an objective perspective. And there's so much that goes into driving that we forget because we've been doing it for decades, right? And I'll ask Brianna, we just did a recent webinar actually on driving and Parkinson's with an expert who's been researching this for many, many years. And Brianna, if you could send Edward the link to that webinar, and also we'll put it in our program, additional resources for everyone to explore further. Thank you so much, Erin.
Of course.
I'd love to ask the question, is there such a thing as waiting too long? Is there such a thing as waiting too long to transition into moving into a long-term care facility or assisted living or any of the other options that you outlined? Is there such a thing as waiting too long for that transition?
I would say no, in that I think care transitions can happen anytime. The caveat being it can be a very chaotic, if we wait for a crisis, it can be very rushed and chaotic. And again, kind of take that person's voice autonomy out of that process. Right? Unfortunately, there are situations where symptoms are such, especially cognitive symptoms, where, someone lacks maybe complete appreciation and understanding for, how their symptoms impact their decisions. And so family often may have to step in and kind of make the tough decisions. So I would say no, there's never a time where it's too late, but of course, there's times when it's very chaotic and unideal. right? And this is
Yeah.
when
And I'm
often.
hearing too that there's possibility for like a reactive decision versus a proactive decision. So could you speak to maybe like the risks that might increase if you happen to make this decision reactively rather than proactively?
Yeah, absolutely. Right. So when we're being reactive again, like, and life is full of having to react. So there's nothing inherently bad about having to react and make decisions on the fly because sometimes that's the situation. And, it necessitates a immediate decision. But again, how are we not, by being reactive, um, are we not maybe we don't know what the person would have wanted. We're not hearing their care preferences. We're maybe not even, we're not able to peruse and explore facility options. What is the ideal? Maybe we're having, this often happens in discharge planning from a hospital, in that maybe someone with Parkinson's is having a lot of symptoms, they get admitted to the hospital, they're being discharged, and going home is no longer feasible. So then the family is having to make decisions on the fly, right? The discharge planner's coming to you, we have to send a referral. Where do you want to send a referral? Well, I have no idea. I've never explored this. I have no idea what options are out there. Well, you're going to be under a time pressure, and maybe the discharge planner is going to say, well, I'm just going to send it to these facilities, and whoever accepts them, that's where they're going. So, again, I say that not to be catastrophized and fatalistic, but again, I think that is an example, a real world example of where this lack of planning can come up, and impact decisions. And it's not to say that, once, go to a facility, if you don't like that facility, of course you can transition. But again, that is a real world example of maybe where the pre-planning, can go awry and kind of leave you feeling overwhelmed and having to make a decision that you wouldn't have otherwise wanted to make.
Yeah, and this speaks to one of your key takeaways was start earlier, have the conversation earlier rather than later, so that in those moments where there's a lot happening, and you said before I had interrupted you, it could feel really chaotic, you know? So by having these conversations early before it is chaotic, you have decisions that are already made in place that you've collaborated on. So you're not alone making these decisions, but something you and your partner or your loved one with Parkinson's have collaborated on
Yep.
and know where to go next. We got a question from Joe, and Joe, I'd love to get a little bit more clarity, but I'm going to pose it just the way that you wrote it in for Erin. Joe shares that his wife has been in long-term care facility, had great recommendations, and after a year, they said that she needs to move because they can't provide the care that she needs. When they moved her, they found 3 months of medications that was never given to her. And his question is, what do we do now?
Yeah. Big question. So, right? And this again begs, like, care needs evolve over time. So, just because a facility works now doesn't mean that it's going to in the future. So I think that now begs a time to start interviewing other facilities or levels of care, and, using those checklists and discussions and kind of bringing, key elements. Hey, my wife, this is her diagnosis. These are her care needs, and interviewing facilities. Can you, meet her needs? So I think, Joe, this is a tall task, achievable. And I would say whatever supports you're connected to, asking them for help. But it does sound like the situation, begs interviewing and touring other care options and care facilities to see if they can provide the appropriate level of care. I also would be curious, like, what is the current facility saying in terms of what aspects of care they feel like they can't meet the needs of? Do we also need to involve the neurologist, the doctor, in terms of managing those symptoms? So I think it's dual, can we manage, the care needs from a medication, non-pharmacologic standpoint? And do we need to explore other facilities? I think these are situations that kind of beg us to do more exploring.
Yeah, and asking the question from the care facility, what can't you provide here that your opinion that I need to find elsewhere to support her can be a really good starting point to have those conversations with other potential facilities.
Yes, exactly.
Joe, was that helpful for you? Let us know in the QA. Thank you, Erin. Really appreciate you. Just honoring and respecting our time together, I'd like to ask just one more question before I let you all go. Post-move adjustment, right? We've been living in a home, I don't know, 20, 30 years. Once a transition has occurred, what steps sort of help individuals or families settle in and feel a renewed sense of belonging or even autonomy? What can help us in this transition between, okay, we've just moved from a home we lived in many years and now we're here?
I think first and foremost, expect and acknowledge the emotions. This is huge. And I think this is also where I'm often talking with individuals and family members about getting emotional support for themselves, connecting with others in similar situations. I think we would be remiss to say emotion. It's not, I mean, it's an emotional roller coaster to go through this. We're not inherently prepared for this. It's probably one of the toughest transitions that life can bring. So I think just being open and honest about that piece of things. And, transitions are not always easy. So I think also depending on their specific circumstance, working with the facility, like what's helped other residents, if you're anticipating a rough transition, being open and honest with the facility. But this is also where visits, can be helpful. Bringing as much of the home where they were into the new environment. And I mean pictures, photo albums, creature comforts, like favorite snacks. I mean, really stocking that home environment, like with the same things that they enjoyed to do and have around them at home. So, like, really make it a home environment. I think can help ease that transition. And again, right, is the constant reminders like yeah, you're in a new place, but, like, I'm still here, right? You're available via phone, maybe there's video visits, there's activities, going if you are a care partner, going to the facility and joining activities with them. So I think, you know, just because there's in a new physical location doesn't mean that you have to be gone, and, requests, to be home, "I just wanna go home," are so much embedded in I want to be comfortable. So what can we do to bring that comfort to the new environment? Appreciating that it's not a, you know, um, one-to-one fill-in. It is different, but again, are there, being open and honest, connecting with others, bringing as much creature comforts to that process, with visits, phone calls, can be helpful with that transition as well.
Mm. I love the encouragement to personalize. This is where we can get personal. This is your new space. Let's make it yours. Favorite blanket, favorite colors, favorite picture. Yeah, new curtains, maybe if that's allowed at the facility. Just really personalizing the space that allows the person who's living there now to feel like it is their own space.
Absolutely.
Erin, any final words to share with our community about is it time to move, next steps in care before I let you go?
Again, just wanting to reiterate that again, these tough topics, while uncomfortable, uncomfortable doesn't always mean bad. And often it can really mean that it's important and necessary to talk about. So I think, pacing is important. But again, if you can kind of get over the hurdle of the initial discomfort, I truly, truly believe that like relief is on the other side. And again, just we don't need to have these conversations neatly resolved in, one conversation and maybe we will never be fully on the same page, but that's not the same that's let's not that have that be our goal. We're hearing each other, we're starting these conversations again in the vein of open and honest communication. I want everyone's care preferences and voices to be heard. So again, I would say, have these conversations often and early as possible and ask for support when needed. Asking for support is sometimes one of the hardest things you can do, but truly, truly necessary. And again, having to transition into a care facility is not a comment on, the caregiver's ability to provide care. It's just sometimes the situation necessitates outside help.
So many pearls of wisdom to share with us today, Erin. Thank you for the work that you do with such compassion and expertise. I really appreciate you joining us for today's Wellness Wednesday webinar.
Thank you so much, Krista, and thank you for all joining us today.
Yeah, and again, thanks to all of you for joining us today. This is the next step right here is the courage to explore what this conversation could look like. So I want to just applaud and acknowledge each of you for showing up to embrace this conversation to begin with. So thank you so much. And we want to thank today's webinar sponsor, Acadia Pharmaceuticals, for supporting the mission of the Parkinson's Foundation. If we didn't get to your question or you didn't ask it, new ones come up as you process information. We're here to help. Visit our website at parkinson.org for a wealth of resources on Parkinson's disease or reach out to our expert team directly. You can call our helpline at 1-800-4PD-INFO or email us at helpline@parkinson.org. We're ready to support you every step of the way. Before we wrap up, we have one last favor to ask you. Your feedback is essential to shaping the Foundation's programming. As the webinar concludes, a survey will pop up on your screen. Please just take a moment to share your thoughts and let us know what topics you'd like to see in future sessions. And again, thank you so much for joining us today. Together, we can navigate this path and continue building a brighter future. Thank you for being with us, and we look forward to connecting with you at future programs. If you have any questions or would like additional support, don't hesitate to reach out. Take care and be well.